When you have incontinence, your world revolves around trying to find a bathroom. I go out with people, but I couldn't even focus on what they were saying. The only thing I could think about was the door behind them that said restroom on it. And when you use the bathroom so much and you don't explain it, people come to their own conclusions. They notice it. It's really embarrassing, and you feel like you're carrying around some horrible thing that nobody would understand.
Even driving my car got to the point where it was dangerous. I couldn't even concentrate or drive more than 15 minutes without having to stop and use a bathroom. Just going to work, I'd have to stop 2 or 3 times. And, what do? Do you go into a restaurant and buy a cup of coffee or what? What do? It gets to the point where you don't even want to go out of your house. You want to stay in so you can be near a bathroom.
For the millions of women and men who suffer from urge incontinence, urgency frequency, and/or urinary retention, life is a struggle for normalcy, especially when treatments such as drugs, exercises, or use of catheters don't improve their symptoms and quality of life. Your physician has recommended that you be evaluated for use of interstim therapy for urinary control. This innovative treatment is helping many people regain freedom and control in their lives. Interstim therapy uses a stimulation system which is implanted or placed inside the body. The system includes an implantable neurostimulator and a lead. This system provides electrical stimulation of the sacral nerves located in the lower back. The sacral nerves control your voiding function. The neurostimulator is a battery-operated device and about the size of a stopwatch. It sends out electrical pulses through a lead to the sacral nerve. The electrical impulses stimulate the sacral nerve, which influences the behavior of the bladder.
My initial reaction was wires, electricity. That has always made me nervous. Electricity in my body sounds kind of funny to me, but it is an absolute miracle.
And I thought, there's no way I'm going to have wires hooked up to my body. I was baffled. I didn't know how it could work.
The advantages of this form of therapy are that it represents a new approach, different from using drugs or surgeries on the urinary tract that can be painful or debilitating. Another significant advantage is that it can be tested, and we can know ahead of time which patients the therapy is likely to benefit. And lastly, at any time once the therapy is started, it can be turned off and the patient can go back to the way that they were before the therapy.
The first step is to see your physician. You'll talk about the past treatments you've tried and their results and have a physical exam. At this point, your physician will evaluate the potential benefits of treating your condition with interstim therapy. The best way to determine if interstim therapy will work for you is to try the first stage of treatment called the test stimulation. This involves placing a temporary stimulation lead in your lower back and attaching it to a portable stimulator. You then wear this device for a few days to see how the stimulation affects your symptoms. If you get good symptom relief, long-term therapy can be considered.
The test stimulator is wonderful, and I'm glad that I had a chance to try it so that I could see for myself if it was going to work.
Then it gives you a chance to find out how really miraculous this thing is.
Placing the test stimulation lead is a fairly simple procedure and usually takes about 30 to 60 minutes. First, your physician will numb an area on your lower back with anesthetic, and using a needle will carefully insert a lead along a sacral nerve. Then you will be asked some questions about what you are feeling to confirm that the lead is in the correct position. Several repositionings of the lead may be made to verify the appropriate sacral nerve to stimulate. Once an appropriate response to stimulation is verified, the lead is secured to your skin with an adhesive dressing and attached to a device called a test stimulator. Your physician will show you how to turn the stimulation off and on using the test stimulator. You can then go home and resume your normal activities with a few restrictions. You may experience some discomfort or soreness where the lead is placed. If this occurs, talk to your physician. You will also be asked to keep track of your symptoms in a voiding diary. This information is critical in helping to determine the effect of the stimulation on your symptoms.
It was amazing. Within the space of 24 hours, my symptoms started clearing up.
I wore a device on the outside of my body for 3 days, and I couldn't believe that in 3 days most of my symptoms were eliminated.
Most of the patients that we have done who have had a successful test stimulation want to have the implant right away. They don't want to wait because it made such a difference in their quality of life. Many people, for the first time, they slept through the night, or they only got up once while they're used to getting up 4 or 5 times at night. So in that sense, the test stimulation is really wonderful for the patients.
It's a fairly simple procedure, absolutely, definitely worth trying to see how it goes. After you go through that, you'll just be looking forward to your surgery in a way that you never thought you'd look forward to surgery before.
After the test stimulation period, your physician will remove the test stimulation lead. If you experienced improvement during the test stimulation, your symptoms will probably return. Depending on the results, your physician may suggest another test stimulation trial to verify the effect of the therapy on your symptoms. If your symptoms improved significantly with the test stimulation, implanting the interstim system may be recommended. If you and your physician agree this is a good choice for you, you'll move on to the second stage of treatment, the implant procedure.
The second stage was a little more involved, but at that point, my spirits were really up because I had walked around with that temporary implant for a week, and I knew what was going to happen after the surgery, and I was very confident.
The implant procedure involves surgically placing the neurostimulator, extension, and lead under the skin. This surgery is performed under general anesthetic and requires a hospital stay of a few days.
After they're discharged, they have to take it easy and rest at home for about a week or 2. There can be discomfort with sitting and moving, particularly related to the incision in the lower back. Patients usually want to feel the stimulation that they felt during test stimulation as soon as possible, and we will usually initiate stimulation with the device on the day after surgery.
This device has given me such an amazing sense of freedom. I can go out and have dinner with friends and not get up. I can see a movie, the whole movie, and not have to get up. But the most amazing thing of all is I can go and run, and I've never thought I'd be able to do that.
All my symptoms have been eliminated, and I can now fully enjoy family life with my wife and children, and it's really a life-saving device to me.
Once the system is in place, your physician will adjust the stimulation periodically to achieve the best results possible for treating your symptoms. Sometimes a second operation may be necessary to make adjustments to the system. The patient programmer lets you make minor adjustments to the stimulation, as well as turn the stimulation off and on. You can also turn the stimulation off or on using a magnet that fits in your palm. If you suffer from certain bladder control problems and have tried conventional treatments but did not have good results, interstim therapy for urinary control may offer you a more effective treatment for your condition. You may discover that it's the right treatment option for you.
I'm now able to enjoy life to its fullest because I don't ever have to worry about pain or thinking about functions that are automatic. I now can control whatever I want to do. and has made my life free.
Again, I had been through so much. I hadn't expected anything to work at that point, and this did. I remember with that temporary implant, we sat in a movie, and at the end of the movie, I started crying, and my husband looked over and he said, "That wasn't even a sad movie. Why are you crying?" And I said, "Do you realize I haven't left once?" And that was the first time that I knew this was working, and that, my life was going to change now.